My name's Alison.mccrossan. I'm the local officer with the Scottish Health Council in Argyll and Bute. We've come to Islay today to catch up with two volunteers who are involved with the Islay Service Review. Their names are Pat McGran and Anne Pillay. We'd also like to speak to Christina West, who is the locality manager for Mid Argyll, Kintyre and Islay, who also co-chairs the groups.
I always felt I wanted to give something back to the island that had always made me and my family quite welcome. So when the opportunity came up to be the chair, I applied and fortunately got the job.
We realised we needed a chair to keep the momentum going when, unfortunately, our chair became sick and hasn't been able to attend the meetings. And in the face of no opposition, I stepped into the chair's role, or the co-chair's role.
The community on Islay and staff on Islay have been subjected to several reviews over the last few years, and the feedback I'd received from community members and staff alike was that the reviews had made no difference to services, everything had stayed the same. So involving community members in the review process was really key to being clear about what they wanted from their health services, what were their priorities and what did we need to do to make a tangible difference to them.
When the local GPs announced their resignation from the out-of-hours care, and there was a public meeting which I, as a resident of Islay, went to, and so I joined the local group really as a resource to lay people to explain how the NHS worked and the terminology and so on.
And like with many local groups, people didn't want to step forward and always take the responsibility of being a chair because it can be quite daunting. So again, I was slightly reluctant to do it, but I have quite enjoyed it, and I think it's PPF is a very important part of Islay life.
Now to implementation phase, it was really important that a sense of ownership and partnership working was really established, which I think it would be fair to say hadn't always been present through the review process. So now that we're in implementation, it's really important that the community on Islay own the vision that we're trying to implement and that they have a vested interest in seeing it succeed. There was a decision made that we needed to set up a comms and engagement group very quickly after establishing the programme board, and the initial members of that group then went out to the wider community trying to really bring a wider representation onto that group rather than just the community council and the PPF, and they worked very hard to try and get people from various corners of the island, sometimes successfully and sometimes not so successfully.
Being appointed co-chair has raised my profile in the island, and people's expectations of what we're going to achieve are somewhat daunting to me just now, and I think it's going to take a month or two for things to settle down.
I knew how important it was to chair meetings so that they actually achieved some objectives and people felt they were getting some benefit from attending the meeting and having the things they thought were important discussed.
I feel quite confident to run the meetings and grasping the notions and the concepts behind it, but it's a matter of finding that fine balance between bringing ideas from away and not taking over on the island itself.
I think it is different chairing a meeting when you're part of an organisation and you're working with staff. It's slightly different when you've got a very varied group, and which includes members of the public, because not everybody is always up to speed on the jargon, the language, the policies. So you have to pace the meeting so that everybody feels included and not left out of the discussion.
I suppose the simple answer to that question is no. I knew what to expect. It's just a matter of getting to know the personalities and the local politics.
Some of the progress was impeded slightly. That's not critical, but it was impeded slightly because people weren't using the same language and perhaps I didn't have the same values.
Communication, and that would be it in a nutshell. We've not done it well enough, we've not done it simply enough, we've not always known the purpose of the communication. So I think probably starting again, yes, I would spend more time in the planning of that and having a think about actually what the purpose of our communication is and what we're looking to achieve out of it. Oh, you want me to talk about me?
What was the rest of it? Sorry, I've lost that bit.